I'm so excited today. We have the most amazing panel, and as I was reading about everyone, I just couldn't wait to hear what they had to say. What I'm going to do is introduce each panelist one by one, and we'll have each panelist come up and give a little presentation, and then sit back down, and the next panelist will come up, and then our panel will assemble, and then we'll turn it over to questions from you. So our first panelist is Dr. Nida Chenagtsang, and Dr. Nida was born in Tibet in Lhasa, and there he both teaches, and he is the founder and medical director of the Weirich International, which has a mission to preserve and promote traditional Tibetan medicine. He did his Tibetan medicine training at Lhasa Tibetan Medical University, and he has some special knowledge about ancient medical practices that have been or almost been lost, which in one of the workshops you can witness today. So it's really exciting for me to welcome Menpa Nida up today to give us his presentation.
Good morning, everyone. And so firstly, I want to thank the Kunde Institute to giving me this opportunity to give a short speech. Actually, I'm not so interested in the academic world, and I hate universities, hospitals, and clinics. So I'm super excited how to help these underserved communities. So in Tibetan tradition, we have a word is called Menjin. Menjin means like free medical camp, you know, how to treat people, how to treat patient without a charge. We call it the Menjin, so the practice of the generosity with medical science. So that's why I'm very interested in this topic, you know, underserved communities, international communities. Actually, this is my favorite topic. And then just a short thing, Dr. Kunchok Gyaltsen, he's from Amdo, my Amdo friends, so now we have to argue here. I'm actually maybe one of the main person I want to use the word of Soarikpa, because in any case it's a Tibetan word, so that's one of the main reason. And then recently there's huge movement in China, so it's called, in Chinese it's called Zhonghua Minzu Yixue. And if you translate this in English, it's traditional Chinese medicine, which is TCM. So therefore, under the TCM, they listed more than 40 natural medical systems, of course, including Tibetan medicine, Mongolian medicine, and medicines from Uyghurstan and so on. So therefore, somehow when we use that word of Tibetan medicine, so it according to Chinese officials, it had to be part of TCM. So because I'm living in the West, I don't feel so comfortable to saying Tibetan medicine, and then we have to say somehow it's a part of TCM. So anyway, we will discuss about that. And then here is I'm going to talk about a few topics, Soarikpa, Integrative Medicine, Sorik Ed, and Nepal earthquake. And then serving the communities in remote areas. So mostly I have images. Actually, you can read it, so we can save time. Soarikpa is the ancient healing science of Tibet, but it's practiced by many Himalayan regions, including Nepal, Bhutan, Ladakh, and so on. So in Nepal, finally we legalized, since 2 years, we have legalized the Soarikpa as a national medical system, and we got permission from Nepali government, but we are unable to use the name of Tibetan medicine because the name of Tibet is becoming highly sensitive and political, so we could not use that name. That's why, of course, our college was criticized by many Tibetan doctors saying, why you don't say Tibetan Medicine College? But if we use that name, Tibetan Medicine College, the word is very sensitive, and then we had to face many difficulties. So therefore, our college is called the Soarikpa International College in Nepal. And yeah, that's about Phuoc Rigpa. So its primary goals are prevention of imbalance and treatment. So it's simple. And then this integrative medical system. So as Dr. Kunchok is saying, when I was trained in Lhasa Mensikong College, and also we had to study Phuoc Rigpa like 70% and 30% about Western medicine. So that time I was kind of confused, like other students, but later I think that system also not so bad because we are living in a modern society and we have to understand, the modern science and about disease and treatment and all these things. That's why to studying like two kind of medical science together, and especially we can say Western medicine and Eastern medicine, it was a kind of challenge, but as a result, I think it's quite good. Because of that knowledge, I was able to also communicate with Western doctors, to discuss different type of pathologies and so on. Okay, so integration here, the building bridges, local healthcare practitioners, and then education. And especially my education is, of course, it's important, the Phuoc Rigpa education to bring to the West, but I'm more interested in the general education, medical knowledge in the underserved communities, basic like hygiene, for example, in Tibet, that's so important. And then like STD and other like simple lifestyle recommendations and so on. So that's why for me, the Phuoc Rigpa's benefit, it have to be beyond of universities and clinics and hospitals. It should be a basic education for general public. So these things, what Phuoc Institute or our organization, we try to do. We bring the Westerners to Tibet to study the indigenous plant and so on. And then trainings in Siberia, and then like Dr. Kunchok Gyaltsen mentioned about organizing conferences and these things. Actually, our organization, Phuoc Rigpa International, we are very active in Europe, and but we are not so known by Tibetan doctors, which is good too. It's a joke. Okay, so Phuoc Rigpa's first ed. Actually, when one of the main reason, the Nepal earthquake in 2015, and of course when the really interesting thing is how much we focus on the on the Western medical science, and how much we consider like natural medicine, Tibetan medicine, TCM doesn't matter, Ayurveda, how they considered as a secondary medical system. So when there was the earthquake in Nepal, of course, everybody is helping the earthquake victims in a very different way. But I wanted to help the victims through Tibetan medicine or Phuoc Rigpa. And many people, they had very strange ideas. They said, Phuoc Rigpa is good for treating digestive issues and treating like very chronic disease and this and that. So the first ed, Phuoc Rigpa first ed, they think it's impossible. I said, I like to do the impossible things. So therefore we started, and we are collaborating with many local Phuoc Rigpa doctors. And yeah, the 80% is Phuoc Rigpa, and then 20% is Western medicine. And so somehow what I would say is the result was really amazing. And as you know, earthquake is not only like bone fractures and bleedings, hemorrhoid, these things, not the hemorrhoid, hemorrhage. And so there's so much like PTSDs. You know that word, right? And so many people are suffering from insomnia and like psychological traumas. Tibetan medicine was really perfect, Phuoc Rigpa. So here we are treating them. And then also we have this, for the last 15 years, our group, we tried to help, many different places in Tibet, Nepal, Mongolia, and Siberia, and so on. And my personal work is more on education, and, I'm teaching more, but this is really my favorite thing to do, directly practicing and to helping the local people. So some pictures are from Tibet in Amdo, and some are in Nepal. And so I think, yeah, East and West integration. This Dr. Kunchok Gyaltsen said in Tibet is already happening, or also in China is already happening, because many patients, they have freedom to choose, And the most important, like he mentioned, in China, according to Chinese law, the Tibetan medicine doctor or TCM doctor or the Western medicine, we have equal status, That's something very important. And so I think the integration part also really important. And then, of course, we are talking about the building bridges. That's the title of this conference. So probably we are going to, we are going to discuss later. And the thing is, I used to work for MSF, Médecins Sans Frontières. This is international, a group which is doing serving the, underserved communities globally. I used to work for them, and I have seen also the work of Red Cross and UNICEF and these massive organizations. But for me, their work is kind of useless, because I used to work for them and I know what is the result. If you ignore the indigenous doctors and healers, if you don't collaborate with them, your result of work is not effective at all, Because you can go there, you measure their blood pressure, you say, oh, you have hypertension, what you do? Take some pills. How long you take these pills? It's a lifetime pills. Okay, you give them a free medication for 1 month, right? 1 month, it's okay. Then how about the next 40 years? So that's why for me, I really strongly against the work of Red Cross, UNICEF. Maybe it's a different place. Maybe it's too strong if I say against. But personally, I don't see it so effective if you don't collaborate with the indigenous healers and doctors and physicians, whatever you call them. And so then, the public education, of course, the books and these things are important. I think 1 minute. Okay. Training, basic hygiene, STD, already. And the cross-training for Menpas, that's I said already. And this is something also important. Today we cannot say, oh, I'm a Soarikpa doctor and I don't know anything about medical science. And then, then we can't have the confidence from patient. And if there's no patient confident, even we have compassion and even we have a good motivation, somehow it doesn't work. That's why I think it's very important to have these basic knowledges. Okay, and our neighbors in need. So this one, you can read it, right? This is in America. Communities of color. And one thing I want to say is in Europe, we try to help the refugees, So that's the thing. I'm not the type bring Soarikpa in the universities and hospitals and so on. I really like to use Soarikpa to serve people. That's why in our organization in Europe, we're helping Syrian refugees, all right? So Syrian refugees, they don't know anything about Tibetan medicine or Soarikpa. We just go there to help, volunteer 1 day, 2 days, and we teach them some kind of massage and some kind of, therapies, which is that they can use by themselves, practice by themselves. So those are the benefits of integrative healing system, accessible, low cost, and sustainable, and effectiveness, and lower side effect. This you know already, right? And for example, when I worked in the Médecins Sans Frontières, MSF, so when somebody is having a pain and you give them painkillers, and then the painkillers, the most the case is for 7 days. So in 7 days, if the pain is still there, and then they just say go to hospital. And if we send the patient to hospital, then again it's about the cost and journey, especially the patient from remote areas. It's becoming a really big headache. So that's why if we are able to educate local people, for example, doing really simple therapies, massage, or acupressure. I'm not talking acupuncture, that's a needle, it's more medical, but acupressure is kind of very simple. And then there are different types of, how do you say, compresses, cold compress, hot compress, and like this kitchen spices, the medicine at home. So that's why I think this part is really, really, really important. And 0 minutes, finished. I'm on time. Thank you.
Next, I want to introduce Dr. John Rosenberg. Dr. Rosenberg studied medicine in Pennsylvania, which is a really, really long way away from California. And then he spent his career in the emergency room at Kaiser in Redwood City. Since retiring, he's volunteered in medical camps in the Philippines, in India, and Tibet, and he's cared for kids of incarcerated patients as well here in the US. And he's taught medicine in Lhasa City Hospital in Tibet. And since retiring, Dr. Rosenberg has seen 80,000 people in underserved communities. So my first question for you is, what does the word retire mean to you?
It means I get to do what I want.
Really what I want to know is what keeps you going back to work or going out to work in these areas, and what connections between the communities, and you don't have to answer it now, do your talk, but if those themes come up and it's appropriate, if you could speak to that. Yep, that one, and this is here recording you for the, so we'll just leave that near you.
Okay. First of all, I want to thank you, Dr. Weirich, and I want to thank you, Dr. Yangdranla, and I want to greet everybody here. It's really an honor and a pleasure to be here. That's me in 1971. I was a medical student. I was trekking in Nepal. I actually think I was drawn there. I'd never seen such a happy place, such happy people, or such a beautiful place. And never had I seen such poverty or lack of medical care. I really loved it there, and it changed my life. And as a result, I've tried to provide care in such places ever since. What is personalized care? I want to say a few words about what personalized care is to me. When I was a kid, my dad encouraged me to tag along to his office and on hospital rounds. I observed that he knew every patient, beyond just their medical problems. He respected and cared about every patient. It was always sir or ma'am. And he loved medicine. I assumed all doctors were like him, but eventually I found out that's not the case, but it should be. Why I'm here. The practice of medicine I love most is organizing and working in medical camps, like Dr. Nida was talking about. I've done maybe 250. Sometimes I'm the only doctor, sometimes there's 30 or 40 or more. And I'm here to share what I've learned about integrative medicine from these experiences. Here are a few examples. This is a nunnery in eastern Tibet last summer. There were 600 Anis, 7 Menpas, who were also Anis. They care for not only the nunnery, but also the local community and a fair amount of nomads and people who pass through that area. And what they wanted to discuss at length, 2 problems, tuberculosis, which they have plenty of, and HIV, an old problem and a new one. This is Tubigon, Bohol, in the Philippines after a 7.2 earthquake, which was terrifying, I might add. Note the collapsed church in the background there. This is my friend Farida. She's an Indian-American gynecologist from Florida and an expert on herbal and alternative therapies. Wherever we go, she has a pile of neem leaves, turmeric, a lot of other things I don't know. And we work together in India every year, and she's been to the Philippines twice. This is last February in Assam, India, one of the poorest places I have ever seen. It's only possible to work there through strong local government and hospital support. This striking gentleman was actually quite healthy. He was in his 70s, I believe. But we found some remarkable malnutrition, and in one area there was extreme heavy metal poisoning from the water. Arsenic, fluoride, lead. What could they do? It's from the well water. I want to describe briefly 3 models of integrative care for underserved populations. That's Dr. Nancy Harris in Kunchok, Tibet, in 1993, being given samples of Tibetan medicines by Menpa Rinpoche to bring to California for analysis. Dr. Harris went on to found the Terma Foundation, focused on education, nutrition, and medical care. I went to Tibet 4 times for Terma. That's where I first experienced these medical camps. We always worked with Menpas. We did the acute care usually, and they did the chronic care. They were very rudimentary camps. We had no diagnostics but our stethoscopes and otoscopes. Now I work with other organizations in Tibet, like Tibet Village Project and Boulder Lhasa Sister City Project, to name 2. And we still use some of these Terma materials for education. In the Philippines, I work with Philos Health, founded by my friend Forrest Malikoff. Theirs is a more sustainable model due to strong local partnerships and a limited target population consisting of about 35,000 people residing in 1 town and in 32 villages. We see about 700 to 1,000 patients every trip in 4 camps, and Philos has been there about 65 times. Philos provides excellent chronic care management for diabetes and hypertension in an allopathic fashion, utilizing guidelines, monthly nurse visits to each village, free medicines, computerized records, even hemoglobin A1Cs for the diabetics. We have very good results. In addition, there's an annual surgical mission, a dental and nutrition program for all the children, and it is a beautiful, hot, friendly place. In India, I work with Indian Muslim relief and charities, started by my old friend Mansoor Ghori from Kaiser. The most incredible camps are in India that I've ever seen. The scale is massive. Thousands are often seen daily. Sometimes as many as 30 or 40 doctors are in one camp. And we see about 6,000 to 10,000 patients per trip. This will be the 10th year of the India Health Initiative, and we've worked in 16 of the 29 states in India, last I counted. These camps are really quite complete. We include Unani, Ayurvedic, and homeopathic practitioners when possible. We provide imaging, X-ray, ultrasound, laboratory services, surgery, eye care, and a huge pharmacy. These are amazing experiences. Why integrative medicine? Why is it important? First of all, for effectiveness. We always want whatever works the best, wherever it's from. Second, acceptability. To succeed, we must provide what is acceptable to the patient, to their medical community, and to us as providers. Third, availability. Cost constraints and limited resources frequently determine what is possible. And traditional treatments are often the most cost-effective. For example, that was a camp in Medragankar in Tibet in 2004. Amshi Droma, I think. She's a Menpa, and she has all her medicines there. And when we go, she's there, and she can continue treating those patients. And she can acquire those medicines there locally. And it's very hard for us to get Western medicine enough to provide for a camp, let alone for chronic care management. So that's our best bet in Tibet. And how do we prove and improve the effectiveness of integrative medicine? We do this by applying the scientific method, accumulating data, publishing articles, and conducting conferences like this. Why is this work important? Well, you can get anywhere on a plane in 17 hours, whether it's Ebola in Africa or XDR-TB in Tibet. We are all at risk. Maybe most important, medicine is not a business. It is a noble calling. We have the ability, the obligation, and the gift to alleviate suffering and pain. Thirdly, although exhausting, this work is exhilarating and satisfying, even addictive. And lastly, I've made lifelong friends, and I've forged closer family ties. My wife and daughter have shared trips with me. And I'm passing the torch. This is my granddaughter, Beethoven. She's pre-med at Berkeley, junior. She's been to Tibet. She's been to the Philippines twice. She's coming to India in January and to Tibet with me again next summer. She does global health as well. She will be a great doctor, and I know she'd make my dad proud. That's it.
Thank you, Dr. Rosenberg. Next we have Menpa Gyaltsen. Menpa Gyaltsen is not only a Tibetan Buddhist monk, not only a renowned writer and scholar, but a professor at Sonoon University Medical College and a visiting professor at University of Virginia Medical School. What's not in Menpa Gyaltsen's bio is why he looks so young. No, what's not in his bio is his exciting work in public health, which he first shared with us at the last Tibetan Western Conference, and which was so exciting to me, and I'm so grateful that he's here to share with us today. Menpa Gyaltsen.
Thank you. Thank you again. Maybe people get tired when I speak 2 times when you are just sitting there. So here I would like to share what I actually do in Tibet. This title is it's a new term for a subject in Tibetan medicine. In English, I call wellness in Tibetan medicine. So Tibetan medicine actually is complex and can be individualized, but also population-based. So for example, like here, I have a sentence from the Yushi. It says, all friends, be sure to understand. Those who wish to remain healthy and those who wish to cure others' illnesses, and then etc., live long, wealth, happiness, and practice Dharma. So those translations are not really excellent ones, but the key buzzword here is remain healthy and then cure others, meaning that prevention and treatment. And then the purpose is live the life longer, so expand the life expectancy. And then the goal is make yourself have a spiritual practice and then wealth. So someone who has wealth and spiritual supposed to be very happy. So I created this with a diagram in my way. So, and then usually, so like a Tibetan model, Tibetan medicine model should be thinking this way. Because the Tibetan medicine, as you know, before 1980, 20 years suffered nothing. Tibetan medicine was not in Tibet because so many Tibetan doctors died during those difficult times. And only some hope we hold for India, but not many there. Earlier I told you not many Tibetan doctors. So with this, I just want to mention that Tibetan medicine is a very complex medicine. Really, we can compete with Western medicine. However, we cannot compete is the personnel. We don't have enough doctors. For example, like in Tibet, we have 2 major medical colleges. So when I look at the numbers, how many people trained, Like in our medical college in the past 30 years, only trained approximately 4,000 Tibetan doctors. In Lhasa, approximately 6,000 doctors. So which means 10,000, right? So then add on those like Tibetan monks, nuns, and then lay people, person like individually trained, I don't think not more than 30,000 Tibetan doctors all over Tibet. Then, you know, in Mensikong, in Dharamsala trained, not many either. Maybe 1,000 doctors. Overall in America, only maybe 100 Tibetan doctors. So the number is great when you hear this, 30,000 doctors, it's not a lot. But when you go to China, one hospital in mainland China, how many doctors in one hospital? 5,000. 5,000 in one hospital. Then you can imagine like a whole, around the world, 200 countries in the world, how many doctors, nurses, health workers working on the subject. So, which means if someone order us to clean this room, so we Tibetans, only one person cleaning. You have 1,000, 10,000 people come here to clean. With your hands, like wipe your hands, you can clean very, very, very clean. But for us, one person need to work at least a whole day. See, so that's why Tibetans are just focused on utilizing Tibetan medicine for cure illnesses today because so many disordered problems. So not many people thinking population-based. So since I was trained in public health by UCLA, so I was trying to integrate the concept of public health and Tibetan medicine. Later I realized after I learned public health, Tibetan medicine has public health, but I didn't know. So really open-eyed. So the model is showing like Doa is the body. So the body needs to remain, live longer. So one of the indicators of success of health is life expectancy. So Tibetan doctors promote long life. When you have a long life, what can you do? You can do the Chi Nur, which is actually spiritual practice and wealth. Person has wealth and spiritual, then you are good. Otherwise, when you have a wealth, no spiritual practice, like people who live in the Beverly Hills, Bel Air, they're very rich. I was with them so many years there. During the night, they take a sleeping pill. No practice at all, dharma, anything. Only practice dollars. So when you have both, then you should achieve happiness. So that's the Tibetan medicine kind of like a model. Then really Tibetan medicine is promoting is remain healthy. That comes first. Our teachers always remind me at that time. So I didn't realize until then. So then if someone really have a health problem, then you're cured. Then go into the forward. So then in terms of understanding of that, so usually I look at this diagram. So a person is a long Chipa Peking formed human body, and then that need to be remain healthy, but usually that change into like altered state by like 4 factors, like excessive deficiency disturbed by time, done obstacles, and then diet and behavior. So those are 4 things. So then those 4 things make your long Chipa Peking become disorder, and then you become ill. So then I was thinking, how can we not alter it? So then in Tibetan we call it Di Dun Se, and you have to, there's one sentence called Yang Tak Den Bi Neme Diorja, properly applied and then no illness and then healthy. So you will reach those. So then expand on that and then like a time, obstacles, diet, and behavior. So I will not go in all those details because this can take a long time. So because my training, I provide the training for my master's, Ph.D. student on specialized this in Tongwen University. So if you like, you can join me in the master's and Ph.D. program. So external environment, living beings, and then those are the concept, and then we created, I'm not going here, sorry. So then we created a 3-volume textbook. So huge book. We worked 4 years, compile all the content from Jushi and other contexts of Tibetan medicine. And last year we had we got an award from the China National Tibetologist Studies. So through this, there are several parts. So for example, like the first part is understanding the true natures. So meaning that environment, like external environment, how we are living on. And then internal, like 6 realms, and then particularly human realm. And then in the human realm, and then there is how can you look at those prevention method of time, and then for example like others like I'm worrying about the time, so obstacles and diet and etc. etc. So we are not going in more detail. So if we summarize this, and then several things like individualized, their content we can apply, and then interpersonal we can apply with the, like a family level, and then the society level. So 3 levels, and those as a guidance of how we can work. So basically, for example, like individual, for example, like healthy for physical body, healthy for mental, and then also gender different, like a male versus female, and then age, like a children, adult, elder. So those needs are different. So with that, I will go with our local project. But before that, this is one of our Tibetan Medical Hospital in Xining, and then we established a wellness center at the hospital. I designed everything I worked on, and this is the process. So for example, like yesterday we used the constitutional form, assess what kind of categories your body type, and then provide different kind of healing to maintain your health better. For example, those are more close to clinical setting, but individualized care. Not much successful, but in the future it will be successful because the project promoted by our one of our leadership called Dr. O, he asked me almost like 10 years ago, in Tibetan, in Chinese called Yangshen Baojian. So in Chinese they have a Yangshen Baojian, but in Tibetan we don't have. So then he asked me to take the leadership to create this, and then I really loved it. So we created this, but not really practical in Tibetan areas. So then, with that, actually, I try to promote that kind of concept in maternal child health. So after I finished my master's degree from International School for International Training in Vermont, So my specialized is nonprofit organization management. So I started the Tibetan Healing Fund and then worked since ever. And then one of our major project is the birth center. So we established a birth center, natural birth center in Repong in 2008. And then so far 5,000 babies delivered there and 200,000 women served. So through this project, what I was trying to do is how we can have a natural birth in the local settings. So there are more details based on our, sorry, those are different languages. So I couldn't translate yet. So several components. You can look at the pictures. So what we did was look at all different kind of literature in Tibetan medicine and also Western, kind of like Western medicine, I would say. So like natural birth setting, like midwifery training, all those concepts, and then integrate them. So I here mentioned as just West. It's not Western medicine. And Tibetan medicine, Tibetan folk culture, and then the West methods. So those three integrate together to set up what kind of conditions we could use. For example, like in the West, you have like a movement skill, breathing, and all those visualizing, those skills are really practical and in the birthplace taken. And nowadays, since I realized that, one thing I realized that after World War II, America went to so fast with economic growth, and women went to the hospitals, got all those the injection, and then later the surgery, and now they are going back to the nature and give natural birth. But Tibet is like in the 1940s and the 50s in America. So promote everybody go to the hospital. So then medical costs are very expensive, and then women scared go there, and so many issues. So then we thought maybe we should promote this because we stay there, and we should work very in the Tibetan way. So that's why I got work on this, and also got a project funding from the government to work on this. So because we reported it to the government officials, that's why everything's in Chinese. So then finally, we came up with one training book. So that's the copy of book. And then this later last year, we published in Beijing. And now this is our manual for the natural birth training. So during those things, during those times, also I brought several of my students to the U.S. and Seattle and California, other places to look at different birth centers. So then we came up with Ngonzhou Ni Gyaltsen. So this is our model. So what it is like, if you deliver in a village, so you have to meet those criteria. So for example, like before you give a delivery, your prenatal check need to be normal. That's the condition. And then also the person really eager to accept like a natural birth. When you have this, and then you have to have those three conditions, meaning that you have a positive attitude towards everything. Some women, it's very difficult deal. Some women, easy. So, and then also your environment is, for example, in case there's something happen, then there's access to the hospital. And then third one is you have to have all those necessary tools available. If you have those conditions meet, you can suggest to have natural birth. So that's the idea. So through those activity, actually, we achieved many things. So one thing is improve, this is the birth center setting, and those are the natural births. There are tons of babies there. Yeah, so, and then those are the numbers each year delivered. And then through that, and then you have to let women to aware. So we had a lot of activities training the women. So for example, one activity we have is through my own hospital in Kumbum Monastery. We have a Tibetan medical hospital funded by a Chinese foundation in Hong Kong. And every year monks go to the community. So then go together to train the women and then provide the free medication. So we reached many, many places. So I don't know how I can provide all the details, but those are the ideas. And then same time, we published several articles on the birth center, all those things. So you can go online, see if you can find them. And then also we train Tibetan medical doctors in the master level and Ph.D. level. So one of my master students is here, Tondo Doma is here. Yeah, thank you.
So next we have Dr. Phuoc Lee. So when I was getting the panel together, I wrote to my panelists to ask, what are some important things you would like me to bring out in your bio? And this doesn't work, it turns out. Didn't work for me because everybody was so humble. So I had to, but Dr. Lee was the worst because he wrote, oh, you can just say my name or something like that. So because of that, I'm going to tell a lot about you. So, Dr. Lee has so many degrees, you have to read them in the bio. The degrees are listed on there, it's just amazing. He double majored undergrad in biochemistry and molecular biology, and that was one, biochemistry and molecular biology. The other one was Asian and Middle Eastern language and literature. And then he went to Stanford Medical School, and then to medicine and pediatrics, then to Harvard, where he did internal medicine, pediatrics, and global health equity. So we can see you can not do only one thing, which is good for us. And then he went out with Paul Farmer to Haiti and worked. Paul Farmer is, for those of you who don't know, for us interested in underserved areas, sort of wrote the book called Where There Is No Doctor, which we use really as the most important text to help us understand how to treat people in those low resource areas. And then he went on to become professor of medicine and pediatrics at UCSF, but that's not all. He's a professor of public health at Cal Berkeley. He did CDC training and then went out to fight Ebola in Liberia and wrote an article about it you can find in the Huffington Post, which is just amazing. And then he started 2 fellowships, which are very exciting, UCSF's Hospitalist and Global Health Joint Fellowship, and also his own HEAL Initiative Interprofessional Global Health Fellowship. So please help me in welcoming Dr. Phuoc Lee to come tell us about his work.
Oh man, oh boy.
I have the mic before that.
Oh boy.
There's something no one knows about this. Do you know why we got here today? Who planted the seeds? This guy.
No.
He started here when he was doing his medical school, and he put the connection with art. Art is humble, sitting behind there. Yes, so that's all we started. That was in back 1998 or 1999. Thank you very much.
Thank you so much.
Yeah.
I don't deserve nearly what you guys have mentioned. Can I, is it okay if I don't use the mic? I have this one. Is that okay?
Yeah.
Is that okay? Great, thank you. Thank you so much. Last night I was talking to my wife. I was like, why am I being invited to this Tibetan medicine conference? I'm not a Tibetan medicine doctor. I'm a Western trained physician. And I'm just like, there are going to be amazing Menpas from all over the world here. Like, what am I doing here? So I hope I can contribute something to the conversation today. And in particular, I'd like to challenge Menpa Nida's remark, I hate universities, because I represent a university. But it'll be a friendly challenge. Hopefully, maybe we'll have some redemption in your mind about university.
PTSD, sorry.
What is that?
It's my personal PTSD.
Okay, okay. Well, I mean, we all have PTSD from being students ourselves. And then I also say I worked with Médecins Sans Frontières, and so we have, points of discussion. Let's just say that. So why am I here? I was asked to talk a little bit about integrative medicine in the context of underserved communities. And so I'd like to share a little bit about the HEAL initiative. It stands for Health, Equity, Action, and Leadership. And it is a community of practice worldwide, including in the US, of people who are really focused on underserved communities. And there's no pretense that it's Western biomedicine only. It really looks at a very holistic view of well-being, which includes, as you've been hearing the last two days, mind, body, spirit, wellness. So I'll speak to that a little bit. But I'd love to also just put a quick plug for Tibetan medicine in Qinghai, because in 2005, when I was a very humble medical student here at Stanford, I was very privileged to be able to help start a medical student rotation of Western medical students to give them an opportunity to go to Qinghai Xining at the Tibetan Medical College there, to spend a month to learn and observe and really gain an incredible amount from the teaching there. And so we were able to pull it off with Dr. R. Johnson's help and Menpa Yangjun Khaosang help, and we did it for 4 years in a row. But because of logistical reasons, I had then gone to Boston for residency. Lots of challenges. We couldn't continue. So for those in this room who have some levers that they can pull at Stanford or at your own institution, I'm happy to share all the curricular pieces and all the setup. I think it would be amazing to have medical students in allopathic medical schools or osteopathic in the U.S. and even elsewhere be able to gain so much from doing an elective rotation in Qinghai. So plug there. Talk to me if you're interested in doing that. So my own personal journey in global health really starts from being from a member of a colonized society. I'm from Vietnam. I was born in Vietnam after the war. And as you know, many people in here have experienced their own history of colonization and experience of being colonized and what that leads to and how that affects people's health. And so the first thing I'd like to do is really acknowledge the land that we are on. This is not land that belongs to the United States of America. Truly, it belongs to the Ohlone people before the United States. If you're actually interested in ever doing something like this, go to this website. Wherever you are, it'll say, actually, who was there before you? Who was there before that institution? And so this area is Ohlone land. And of course, it was taken forcibly from the Ohlone Native Californians. So what do we do at the HEAL Initiative? It is a training program based on this idea of global health equity. What does that mean? It's not equity as in stocks or shares of companies, but really it means that we are truly focused on providing not just equal care, but equitable care, which would address, of course, all of the historical injustices that have led to poor health. So you can't just provide a CT scanner or an MRI machine and call that equal care. Equitable care means overcoming all of the previous injustices and practicing what we call decolonized medicine. And so that's what we do. We bring together trainees from all around the world, 8 countries, I'll show you in a little bit. We train them. They work for 2 years at home in the US and internationally in the most remote places. So at home, we work in Navajo Nation, which is I'll show you a map in a bit. This is a map. Now, I will try to be quick because I'd love to have question and answer and save the majority of my time for a question and answer. This is where our fellows work for 2 years straight during their fellowship. Collectively, they care for about 1 million patients per year. We started out in 2015. And you see here on the left, Navajo Nation, we have 5 partner sites. I'll show you a picture of an example of integrative medicine at one of our sites. And this is true for all of our partner sites. All of our partner sites provide holistic care, provide free care on an ongoing level. So it's not episodic. It is an ongoing longitudinal health system that they work in. And in some of the most remote places, so for example in Liberia, after their civil war, they had 50 doctors for 4 million people. So I mean, you can imagine at Stanford, where I trained here in this hospital, on one floor you'd have about 100 doctors. And in Liberia in 2005, 2006, when they emerged from their second civil war, they had 50 for 4 million people. So you can imagine how challenging it would be to provide care. Not that doctors are the only way to provide care, obviously, but the numbers of people needed to provide integrated care is much, much, much larger than that. And these are the sorts of settings that where the HEAL fellows work. Some of our core curriculum pieces, we truly try to integrate justice. So we go from generosity, which is what I consider charity, to justice. Right? That's 2 different things. Generosity is charity, you do something nice, you go home and you feel good about it. Justice is you cannot feel free until everybody's free. Okay? People like Malala, Yousafzai, those are folks who have championed this idea of generosity to justice. So our curriculum is focused around 6 core competencies. You have to be clinically very, very adept, of course, whether you're an allopathic Western medicine provider or a traditional healer. High quality clinical care is paramount. We also do a lot of training on leadership and advocacy and on health systems. So how do you improve not just your patient interaction with the person in front of you, but really how do you impact the entire health system over time? We focus an incredible amount on ethics, the ethics of being an outsider coming into a community and practicing. And what does that mean? The ethics of under-resourced care. So if you don't have an EKG machine, or if you don't have this medication, that medicine, what is ethically or morally correct to do in that situation? And there are certainly strategies, although we don't have absolute answers. And so the biggest part of our fellowship truly is this community of practice, a community of people deeply committed to spending an entire lifetime serving the most underserved in a way that is equitable. And so far we've recruited about 100 and just over 100 fellows in the last 3 years. They commit 2 years of their lives. They actually get a Master's of Public Health through an online program that we provide. And we've graduated 50 of them so far. And right now they're out at, like I said, 8 different countries, including domestically. The program is not just doctors, but we have nurses and we have pharmacists and psychologists as well. We really don't differentiate between the power of a social worker versus the power and impact of a physician. And this community of practice really connects a global community that brings in the academic side, the university side, and a lot of resources that universities have. It brings in the actual healthcare system that's out there, which includes the government systems that work in, say, Navajo Nation or internationally in India and Nepal. And it brings together global health organizations like Partners in Health and Médecins Sans Frontières, because we're all connected. And so that's what something that HEAL is trying to cultivate during the fellowship and well beyond. So here's an example of integrative medicine. So this is a hospital where our fellows, many of our fellows actually, work in Navajo Nation in a place called Sohoto Medical Center, and I wish I could have brought somebody from there to come and talk to you about their integrative practice. But the hospital has of course, a biomedicine wing, and then it has right next to it, a wellness center, which is about twice the size of the hospital, which is really where we should be focusing our attention. We all know, if you're a public health practitioner, that only about 30% of wellness or health is actually intervenable at the time of somebody gets sick. Truly, you have to prevent so many things, and that's where wellness comes in. Is to prevent all of those illnesses. That's 70% of where we can intervene on health. But once you have to intervene on health, then you can offer many sorts of modalities of treatment, which include Western biomedicine, but also include many forms of traditional healing. So the middle picture is something called a hogan. It's a native Dene people. Dene is the same as saying Navajo people. A traditional structure where traditional healers come and perform ceremonies, healing ceremonies, and give medication. So if you're a patient in this hospital, you could easily have lisinopril in the morning for your blood pressure, and then in the afternoon have a traditional healing ceremony by a staff traditional healer who is equal in say prestige or hierarchy to a staff MD or allopathic Western biomedicine practitioner. But really, more importantly, what you need to do is go to the people who are on the left, which is this wellness center. Mm-hmm. And those are the folks who are working on your diet, working on your well-being, working on your physical therapy and many other sorts of modalities to impact somebody's health. So I'm going to stop there. Feel free to email me if especially if you're interested in restarting that fellowship, that rotation in CNING. I can tell you that 2 of the graduates are in the Bay Area of that program, and they would very much love to, as would I, love to see it happen again. So thank you very much for your time.
Thank you.
Thank you.
Okay, I just want to thank you all so much for those wonderful presentations, and I want to go ahead and open it. Can you guys hear me? Now can you hear me? Yeah. Okay. I want to open it right out to the floor, and I only have the microphone on so that I can repeat questions so that everyone can hear them and get onto the videotape. So any questions for any of the panelists or for the panel itself? And if we don't have one coming right away, I'll go ahead and get things started. So I guess one question I'd like to ask is, what do you think about the word underserved? Is the word underserved an appropriate term? We've used it a lot today, and I wonder what the panelists think about that.
Sure. Oh, sure. There's a big controversy. As somebody who was poor when I was born, poor when I was growing up in the U.S., I prefer the word poor because it's not a euphemism. It's not. It's even though some people might say it's condescending or it's demeaning to say somebody's poor because they're only cash poor. Maybe they're not, wealthy from a perspective of finances, but they have a lot of wealth in other ways. But truly, in the world that what we live in, being financially poor means that the structures around you, the institutions, really try to wipe away all of the other ways that you can consider yourself wealthy. But still, there's a lot of hesitancy to use the term the poor. Right? Underserved, I think, is it's politically correct. It's politically correct. It's a little bit it's a euphemism because truly, people who are poor are the ones who are not being served correctly. And when I differentiate between what equality is and what equity is, this is where underserved areas need more services than rich areas, even more than what the rich are getting. So when you have a concierge doctor serving the rich here in Palo Alto, you need 100 concierge doctors to treat, the poor in Navajo Nation or in India or wherever it is. That's the way to really, create equity, is to provide even more. So that's my take on the term underserved.
To me, underserved also represents people who are poorly served. So my favorite is to go to places where there's no other doctor. You set up in a village or some school somewhere in the middle of nowhere, and you bring everything, and you try to arrange some follow-up for chronic care or whatever is necessary. But we also work in places where there are no medical ethics, such as India. And people get just raked over the coals there by the doctors. And they come even if they have resources. They've had every test, every imaging that's known to man, and they're just getting billed. And they come with a huge file and stuff, and they want an opinion from an honest doctor. And I think that's one thing that really is important that many people have mentioned, is the ethics of medicine. But underserved can be also poorly served or malserved.
That's a great point. Any questions coming out? Great. James Lake.
So, especially to Dr. Nida and Dr. Gyaltsen, you both commented in great detail about the obstacles and the limitations that Tibetan medicine of Soil Rigpa face coming in through becoming part of integrating with Western medicine and Western culture. Those are clear. You've explained them very clearly. Can you talk about what you think would be both an effective and realistic strategy for breaking through those obstacles, especially in this country? How you can achieve the goal of bringing Tibetan medicine, Soil Rigpa, more into mainstream? How can you do that? If you can comment on that.
So just to repeat, the question is about how do you break through the barriers and bring Soil Rigpa more into the mainstream?
So I think it's more a question of collaboration. Yeah, I would say more collaborative way. We can have one patient, and in the biomedical view, they can treat their way, and Soil Rigpa view should have another way to look at the patient.
How can you get from where we are now in this medical system that's very restricted and regulated?
Well, yeah, this
to that
we should.
collaborative?
I think maybe we have to think in two steps. First step is the legalization of Soil Rigpa in U.S. That's the big question. And the second step is how to make it very practical in U.S. And if we make it very practical, I think the work should be, if we do a research together, for example, I know you are a psychiatrist, professional psychiatrist. So if you see the patient has a depression, bipolar depression, whatever, it's your diagnosis and your treatment, probably we have a different way to diagnose about this case. Maybe for us is the lung disorder in the heart or in the head or in central channel, So that's why I think we should respect the both views about our own diagnosis and our own treatments. And so I think that's the best way. Normally, in my view, in my very limited English view, I like the word of collaboration. Yeah. And also regarding about this underserved words. So for me, underserved is like undeserved. That's because of my poor English. Undeserved. So underserved is kind of similar. Maybe I like the word like out of service, So maybe probably it's the same. My English not that good, but for me, personally, I like that word too.
So I also integrate with the two questions together. So first, with the concept of underserved, like in Tibetan, in my understanding of this is for me, I don't need a really service because I take care of myself until one day I need help. But that is not a service for me. It's a blessing. Something is from higher from me to give me. So therefore, Tibetans never think doctors are server. Doctors like a teacher. So in the 8th century, Tibetan king gave 13 highly respected points for the doctors. So it's like a teacher. So then Tibetans traditionally, they take care of themselves, and then one day they need a doctor, and then doctor treat like their master. So that's in our culture. So with that, and then in this culture, and then you make us a server, it's very difficult. When I see patients, so they pay me $80 1 hour, so they just think whatever you can do, you do for me. Yes, we do it for you, but then also you should think equally, because Tibetan medicine is a wisdom for ancient, and then you have to understand the complexity of the culture. So, and then in order to bring here, I think at least someone who you are interested in this, you have to think more complex way to how you can accept it. Otherwise, like yesterday we talked about the research. So many people today think research is the way to go forward. The Tibetan medicine became more available and clinically practical. One way I think it's true, but it's not the full picture. So for example, like some people would say, how could you treat arthritics with Tibetan medicine? How that affect? Where's the evidence? People always ask those questions, but we cannot give you the answer because two system. And then people say, oh, Tibetan medicine is unclear. Maybe some part is unknown. For you, yes, it's unknown. For us, it's clear. But we don't communicate because a different system. It's like a different language. So then I ask people, say, okay, so you are a Western medicine, so you can explain everything. Explain to me what's the meaning of aspirin. You can't. They said, oh, there are so many researchers are there, and it's clear. Yeah, but in our case, there are piles of books in on those cases, but can you read them? So maybe too long, but a story. First time I finished my master's degree in 2001, I returned back home, my village. I brought some coffee. One day I told my mother, say, I brought American tea. It's called a coffee. And she drank and said, this is undrinkable. Tastes horrible. Explain to me what it is. Can you explain? And in America, when you say, would you like to have some coffee? I love it. They can like with a rhythm. So, and then, for example, Tibetan children today are introduced with the chocolate. When you look at the chocolate in Trader Joe's, those just look like, you know, those, I don't say the word, a dark, you know, it's like in the bathroom. Yeah, but when you taste horrible, especially the dark chocolate. So, but now people accept it. So, can you explain chocolate to Tibetans what it is? You can't. So similarly, the medical systems are different. So then I would say, like in the room you are interested in Tibetan medicine, should have a more open-minded and then open dialogue, and then how we can together to make this happen. So I think that's the only way to go. That's why Dr. Nida mentioned the collaboration equally. So that's my opinion. So I don't know.
Next question. Yes.
Putting together this word of collaboration integration to explain what it is. I have one question. What is integrative medicine? What is healing? What is cure? What is a doctor and a healer?
So I'm going to repeat the question just for the video. Hopefully I get it right. What is integrative medicine? What is healing? What is the doctor? And what is the cure? Is that right?
And doctor, healer, cure and healing. And what is the principle of that collaboration or integrative medicine?
And-
what that integrative medicine means.
And then more deeply, how does that feed into the meaning of integrative medicine? So why don't I start it this way? Start it this way.
Yeah.
I think this one, if you want to know what is collaboration, what is integration, you should ask Google. Google Dictionary. So according to Tibetan tradition, probably there's not much different, the healing and curing. So as Dr. Kunchok mentioned, as a doctor, our main work is the prevention. And then the second one is healing or cure. Probably, according to Tibetan system, is the same. But in Latin, one is curare, one is guarire. Did you get that?
Exactly.
Curare, guarire. So if you go back to the English, the root word, curare, guarire, or prevenzione, probably you can find that answer. For me, my understanding, integration is you're putting two things together, right? In English.
Dr. Lee would
I'm
know.
asking. Yeah, exactly. But that's why I like personally
Yes,
use.
that's right.
Yeah, exactly. So that
Blending and
blending, yeah, that can be kind of confusing. So that's why I prefer like collaboration. So you are American, and Dr. Kunchok is a Tibetan monk. We have different approach, different views, but we can still do something together. That's called the collaboration. So that's why I prefer that word of collaboration. And in Tibetan tradition, I think healing, the healer and doctor, this basically is the same. There's no difference.
Very good question, philosophical, and I think integration is failed in China. I don't know if you know about those things. So in China, 脏西结合 they call it, or 中西结合, meaning that Chinese traditional medicine and Western medicine integrate. So today, you cannot really find good Chinese doctors. They're in both. So some people make a joke or saying like, I am a doctor, so I was trained Chinese traditional medicine or Western medicine. The patient come to me, he or she doesn't know traditional Chinese medicine very much. I will talk with her Western medicine, allopathic medicine concept, impress her or him more. If the person doesn't know allopathic and some local, and they talk about Chinese concept. But then really the person go into the kind of like the knowledge root. The person is very shallow. The knowledge is very shallow. So I think integrate, it's a very nice word, but which level you were talking about. So one time I gave a talk in Georgetown University Medical School in Washington, D.C. Someone asked me if Tibetan medicine can integrate with allopathic medicine. I said no. Because I studied Tibetan medicine since 1981. I feel still I don't understand a long Tipa Peking. Honestly. But then I need another 30 years to study allopathic medicine. I'll be gone. So how can you make a put together? So like myself, really integrate with the public health, the Tibetan medicine, and Buddhism put together. I'm struggling. Sometimes in my dream, talking Tibetan, sometimes in English, sometimes in Chinese. So confused. So that's why a different level integration is which level you want to talk about. So then healing and doctor, those are English terms, so you have your own kind of definition. So in Tibetan term, soa means like, how do you say? Heal or nourishing or rejuvenation, or it's a wide concept. So therefore, it's not really trade, maybe. So those words, it's very difficult to measure. So we can talk more and more.
I'm not sure how much I can really add to this. I think it's mostly semantic, the difference between a healer and a doctor. And also in many regimes, you have to have a credential to be called a doctor. Other people can be called healers. But integrative medicine to me is all medicine. And I think every medical tradition takes whatever it can get and uses it for the benefit of the patients. And Western medicine is no different. We've incorporated things from all over the world, our pharmacopoeia, our traditional practices. Now Kaiser does acupuncture and meditation. I mean, we are getting there, I think. And it's a question of how well we understand it, how well we can combine it, or whether we have to keep them as separate entities with some understanding of who can do the most good for a particular kind of patient.
I'll just be real quick and just address this great provocative question about collaboration versus integration. And I actually will use a different analogy over that to see if we can get at this answer in the medical or the health context. So let's take education, public education in the US. To me, the difference between collaboration and integration is very, very well documented in education. If you want to have the best outcomes for students of every color, and that's an analogy for every type of person in terms of healing. If you want to have the best outcomes for children of color and children who are not of color, then integration is the only way to do it. Collaboration is lip service. Collaboration means you have your black school there and your white school there, and there's a teacher that goes back and forth. Integration is you have your black students and your white students in the same class. And dozens and dozens of research reports and a lot of studies have shown that integration is the only way you can actually achieve equitable outcomes for all students. So let's see if we can use that to think about how we're approaching collaboration and integration in terms of medicine.
Can I give a comment on this? My idea, sorry.
Yes.
First, I think before we integrate medicine, I think we have blended a culture. There's a cultural barrier for us. We are trying to fit in Western society. I've been I'm not arguing with the word integrated or whatever it is. But first we have to integrate our culture, blending our culture. That's the first step. So that's why right now we are debating on a word. So, like I've been in the West for almost 25 years of my life. I'm 53. Half of my life I'm living in the West. What I learned, and sometimes even a small word, we made a lot of confused. Now I'll give you one example. Complimenting. If I say to Tibetan, "You are fat," is a compliment. People say thank you. Same word if I use here, "Oh, do you think?" They really get pissed and upset. But in the reality, the word is the same, fat. one accept as a compliment, one accept as negative. So we have to blend the culture first. Like I was really agree with Dr. Gyaltsen's view about even the word. Like Nida have his view on like sensitive. If we try to avoid on a sensitive matter, I think at the present it may work. We can work more with the people, and so temporarily it could be good. But we look around about like 40 years later, that sensitive might create some disturbances within the society. We cannot fix right now. We also can fix in the future. We have to think both sides. And so that's my view as living in the West for up 25 years. Still, last 2 years ago, I went to teach in Tibetan Medical Institute. I give a workshop on culture difference. Why I'm using some word, I teach the student, look, some words, we have to be very sensitive in the West, but for here, it's okay, because we accept in a culture. So there are a lot of things, and before I think integrative medicine, so maybe we have to think from another avenue as how to integrate our culture within each other. Thank you.
Thank you. And that was a great question. I want to add too that when we were first working in Bhutan in 2007, we noticed that the traditional health practitioners and the Western health practitioners were located together in the same basic health units. So we were in the process of a knowledge, attitudes, and practice survey of all of the health providers in the system. And so we asked, can you practice both it was Weirich, which is their traditional medicine, and Western medicine? And amazingly, everybody we spoke to said, just like it's obvious, like, no. And here they were working together, inter-referring, side by side, conferring, and so, same, I didn't really understand it at the time, but I hadn't been through all these lectures. But I'm beginning to get it. Next question.
Oh, no question.
Oh.
Just to add yours.
Okay. Yeah.
Because I remember how we put that word as an integrative or holistic, or what word would you choose, right? But in order for us to work with all the medical system, we chose as an integrative. But when we started with Erica, at the first place, we are not thinking about to bring bits of piece to put in, to blend them together to make a smoothie. Like we have blueberries, strawberries, banana, piece, then you blend that. But what we are actually thinking, we blend, and I like the word with the emphasizing on collaboration as well as the integration. So I think maybe there's a different levels we work on it, but our original thought is Erica does Western medicine, and there are tons of things, information you need to learn, and there's a keep updating information you need to educate yourself. As Tibetan doctors, we have tons of books to read. So you only have the most, if you're lucky, you live 100 years old, and how much time you have time to really study everything of others. So we're hoping is, I understand a little bit Western medicine, Erica understands a little bit Tibetan medicine, so the benefit object is the person who will be receiving our integration or the integrity of the function of medicine. That was the original thought.
You guys are collaborating.
Yes.
Yeah.
So it's an integration type of.
With collaboration.
Yeah. So I think maybe the integration has levels like the level 1, level 2, level 3, level 4. But I really don't like the system of integration that you bring bits and pieces to make a smoothie, because we have a big argument with the MD license acupuncturists, because they only need to take 100 hours of acupuncture theory, then you can perform acupuncture on the patient. But as an acupuncturist, you at least need to study 4 years in the acupuncture school in the West. Then you have to pass your hardest license test someone is preparing right now. So it takes like at least 6 months to 8 months, a year to prepare that test. Then you lost, you won't be able to, what I mean is, if you bring the bits of piece, so it won't work. So our system is really working. You understand each other, but you also do whatever you need to do. But we do the integrity type of integrative or collaborative healing work.
So I hate to do this, but I have to break up the party because I know our bellies are starting to wake up from this morning. I will invite the panel. Does anybody have any last thoughts, comments? Anyone? Doctors?
Sure, I'll say a couple words. So earlier, what I was saying is the integration and general. But for this particular conference, and also this kind of particular setting, I think this word is wonderful. Because of this, and then we all came together and learn each other. And so it's a great opportunity to learn from each other. And also, I'm really honored to present our Tibetan medicine concept to all of you. And this is really wonderful. Thank you. Thank you for organizers.